These aren't just tips from the internet. This is advice from Dr. Samuel Vance. After over 1,500 surgeries and years of seeing lives changed or lost, he shares the hard truths most people ignore until it's too late. If you're in your 30s, 40s, or beyond, listen closely. Your future depends on what you do now.
Have you noticed that when you were 20, if you set a goal to lose weight, you could achieve it 3-4 times faster and more effectively than now? You tried a diet, added some cardio, and the weight just melted off. You could lose weight in a week or two before graduation or any event. Why? Because our bodies are constantly changing. And when we once had the ability to lose weight so easily but didn't use it, and then gained a huge belly and now try to lose it again, we struggle. We hit the gym, we do 3 times more than before, and nothing works. This leads to apathy. You feel hopeless. You don't want to try anymore because before, when you trained, you saw results. Your muscles grew, your strength increased. I see guys like that at the gym all the time. Back when I was going to the gym in Versailles, there was this one overweight guy. He came in every day for 2-3 years, even more often than I did, and yet he looked exactly the same. Just going to the gym is not enough, especially if you have health issues. It's not just about hormones. It's not just about training. It's about balance. Many people feel guilt, frustration, and shame that they can't get their life together. And so by 50, you become overweight. You turn into what I call a young old man. Not because you're 50, that's just a number. Many of you at 30, 25, or even 20 can do far less than some people at 45 or 50. The number means nothing, but it obliges you to take care of your body. If you're in your 30s or mid-30s, appreciate that your body can still change if you invest in it, train hard, and stay consistent. That kind of transformation won't come as easily at 50. At that point, the risks increase: heart disease, diabetes, strokes, cancer. Being overweight isn't just about looks. Obesity is linked to a poor anti-cancer immune response. Most of the patients I've seen in our hospital, over 1,500 major surgeries, were obese with bad habits. Rarely do we see athletes or fitness enthusiasts in our ward, and when we do, they always stand out. What changes with age? Let's look at the facts. Yes, losing weight gets harder, but not only that, muscle loss begins. Sarcopenia sets in, and most people shrug it off. Who cares about muscles at 50? Well, muscles are crucial. They store iron, house mitochondria, the energy factories of the body. Research shows that the amount and quality of your physical activity directly correlates with the number and efficiency of mitochondria. They fight oxidative stress. The more regularly and wisely you train, the lower your risk of cancer, heart disease, and atherosclerosis. Health starts with movement. Mitochondria turn food into energy. They decide whether to burn fat or sugar. And when your body is in a state of low oxygen, from obesity, smoking, low iron, it prefers sugar and you crave it more. There is no pill to fix your mitochondria. At 80, try Nordic walking. At 30, go do jujitsu, hit the gym, compete. Every age has its own movement, but movement must exist. The first step to aging is a sedentary lifestyle. The foundation of longevity and health in old age is movement. Once you sit down, you may not stand back up. Sarcopenia isn't just smaller arms. Fat and muscle vanish everywhere, including your face, your heart, your vessels. Sarcopenia is a systemic issue. It's not about vanity, it's about health. With age, maintaining muscle becomes harder, and if your hormones are out of balance because of poor choices and you do nothing to fix it, you'll suffer. Let's talk about prostate health. An enlarged prostate, BPH, is not some random gift from Santa for bad behavior. It doesn't appear overnight. If you're 55 or 60 and suddenly learn you have an enlarged prostate, It probably started developing at 35, slowly, over time. And if you ignore the signs and only go to the doctor when you can't hold your urine anymore, the treatment might leave you with retrograde ejaculation or worse. Not because of prostate removal, but because of delayed treatment. And many patients tell me, but the urologist gave me meds and I started peeing better. Exactly. Symptom control, not a cure. Meanwhile, the prostate keeps growing. The bigger it gets, the more complex the surgery and the more severe the side effects. So yes, if you're 50 and struggling with prostate issues, it's likely your fault. You should have started monitoring PSA markers at 40, even at 35 if your father or grandfather had issues. It's not just about being in the normal range, it's about trends. Just like obesity, cancer doesn't start suddenly. Big things have small beginnings. The earlier you catch it, the better. Before this video, I Googled health issues at 50. I expected male problems to show up first, but I had to go to the third or fourth page. Women are searching, reading, learning. Men don't care. Ever been to a cemetery? Ever visited relatives? Look at the headstones. Grandpa, grandma, they rarely die together. Usually, men die 10, 15, sometimes 20 years earlier. And people say, well, men take more risks, do dangerous jobs. That's not the main reason. We die earlier because we respond worse to stress, emotionally and physically. And the majority of male deaths are caused by cardiovascular issues. That's directly tied to lifestyle.